Key points of psychotropic medication administration include informed consent to explain the purpose, side effects, and risks versus benefits. Psychotropic medications relieve symptoms and don't necessarily cure the mental illness. The purpose of psychotropic medications is to relieve symptoms related to mood, thoughts, and behaviors, to improve clients' functioning, and to increase clients' compliance with other treatment modalities. Psychotropic medications balance neurotransmitters such as serotonin, norepinephrine, dopamine, acetylcholine, and glutamate. Non-compliance with prescribed medications occurs for many reasons: expense, unpleasant side effects such as tardive dyskinesia, discontinuation when clients begin to feel better and believe that they no longer need the meds, denial of mental illness. As a nurse, your role to ensure compliance includes health education about the medication purpose, effects, and side effects, medication education groups, and education about long-acting medications. Documentation about client education should note that the client has been informed about the purpose of the medication, how it will benefit the client, and specific instructions about medication administration. In this case, the client stated he doesn't need any medication because he doesn't have a mental illness. The nurse educated the client about the purpose of Haldol, to help his thoughts be less confused and to calm his behavior. The nurse also explained that Haldol will help with symptoms such as hearing voices or having unusual thoughts. The client was encouraged to take each dose of medication daily and told to call his physician or nurse if he has thoughts about stopping the medication. The nurse also documented the client education. Anti-anxiety, antipsychotics, antidepressants, mood stabilizers, psychostimulants, and sedative hypnotics. Anti-anxiety medications are given on a short-term basis to lessen anxiety and treat sleep disorders. Two basic categories are benzodiazepines and non-benzodiazepines. Benzodiazepines can be used to treat anxiety, insomnia, alcohol withdrawal, seizure disorders, and other mental health problems. The absorption of benzodiazepines is slowed by antacids and food in the stomach. They should be taken only short-term to avoid the potential for dependence and withdrawal symptoms from discontinuation of long-term therapy. Common side effects of benzodiazepines include drowsiness, confusion, and orthostatic hypotension. Alcohol and other CNS depressants can potentiate the effects of benzodiazepines and should be avoided. Non-benzodiazepines such as Buspar have full therapeutic effects in 2 to 4 weeks, so they're not taken PRN. Buspar is an anti-anxiety medication that is not associated with sedation, cognitive impairment, or withdrawal symptoms. Antipsychotics include traditional and atypical medications to treat disorders such as psychosis, schizophrenia, and the manic phase of mood disorders. Antipsychotics can also lessen symptoms, including hallucinations, dementia, aggression, and disorganized speech and behavior. Atypical antipsychotics treat psychotic disorders and negative symptoms of schizophrenia. Common side effects include sedation and weight gain with minimal anticholinergic effects. Clozaril was the first atypical antipsychotic medication and has side effects of sedation, anticholinergic effects, and orthostatic hypotension. Clients who take Clozaril must have their blood counts monitored every 1 to 2 weeks to monitor for a decreasing white blood cell count. Symptoms of agranulocytosis, which is associated with Clozaril, include flu-like symptoms such as fever and sore throat. Traditional antipsychotics have a higher incidence of extrapyramidal symptoms. The 4 extrapyramidal side effects are dystonia, akathisia, Parkinsonism, and tardive dyskinesia. Other common side effects include anticholinergic effects, dry mouth, constipation, urinary retention, and blurred vision. They can reduce the seizure threshold and cause orthostatic hypotension. Cigarette smoking can decrease blood concentrations of antipsychotics. So when a client tells the nurse that he doesn't need medication because he doesn't have a mental illness, how should the nurse respond? Educate clients. Tell them how antipsychotic medications can help with symptoms such as hearing voices or seeing things that other people can't see. These medications can help make thoughts clearer and more organized and help clients concentrate better. For clients who experience extrapyramidal side effects, there are medications to help with these effects. They should be taken simultaneously with the antipsychotic medication to prevent these extrapyramidal effects. Extrapyramidal side effects include acute dystonia, painful and frightening spasms of the tongue, throat, face, jaw, eyes, neck, or upper body. Acute dystonia should be treated with Benadryl. Other extrapyramidal side effects are akathisia, an inner restlessness with outward signs of motor restlessness, pacing, foot tapping, rocking, and an inability to remain still. Pseudoparkinsonism, which causes tremors, hypersalivation, cogwheel rigidity, shuffling gait, and stooped posture. Lastly, there is tardive dyskinesia, late occurring, involuntary, repetitious movements of the muscles of the face, limbs, and trunk. Symptoms of tardive dyskinesia may decrease or disappear for a while, or they may be permanent. Atypical antipsychotics have a lower risk of causing tardive dyskinesia. Clients who are taking psychotropic medications are screened every 6 months for signs and symptoms of tardive dyskinesia so that it can be monitored and reversed early in treatment. There are 4 categories of antidepressants: tricyclics, MAOIs, SSRIs, and non-tricyclics. What should you know about these? Let's start with SSRIs. The effects of SSRIs are generally not seen for 10 to 21 days, and it takes several more weeks to reach the full clinical benefit. SSRIs are not lethal in an overdose, but they can cause a serotonin syndrome that consists of autonomic instability, fever, tremor, rigidity, delirium, and seizures. Tricyclic medications are not tolerated as well as the newer antidepressants, and the suicidal client cannot take tricyclics because of the fatal cardiac toxicity of an overdose. MAO inhibitors have toxic effects that can result in a hypertensive crisis when foods with tyramine are consumed. These foods include cheese, liver, avocados, deli meats, bananas, wine, chocolate, and decongestant medications. Clients taking MAO inhibitors must be taught to avoid foods that contain tyramine. If an MAO inhibitor and tyramine do interact, a hypertensive crisis results. Symptoms include headache, excess perspiration, lightheadedness, vomiting, and an increased heart rate. If you as a nurse suspect hypertensive crisis, hold the medication, contact the physician, and tell the client to go to an emergency department. Here's a common situation that you might encounter. What would you do if a client told you that she had been taking antidepressants for 2 months and wanted to stop? Encourage the client to continue taking the medication as prescribed and talk to the physician or practitioner about the choices for treatment. While a client is taking antidepressant medication, the nurse should continually assess the client's risk for suicide. As the client feels more energetic, her risk for suicide increases. Mood-stabilizing medications are used to treat mood swings and symptoms related to mania, such as expansive mood, flight of ideas, increased psychomotor activity, and sometimes violent and self-destructive behavior. Many clients are given antipsychotics until mood-stabilizing medications are effective. Let's look at this next situation.
I wonder if this client has a mood disorder. He is taking a mood-stabilizing medication. I wonder if his lithium levels have been done yet. Not yet. Maybe the client has just started on lithium. I wonder what other medicines he's taking. Oh yes, he's also taking an antipsychotic. Well, that'll help him with the agitation and the mood swings until the